Sneak attack. We're on.
Just like that. How are you?
Wait, I can't hear you, man. Oh, wait. Let me.
There you go. You
There
figured
we
it out?
are.
All right,
There
awesome.
we are.
Hitting the ground running right then and there. Amazing.
Right off the bat, I love this sneak attack. It gets everyone off guard. As soon as
Yeah.
I'll invite these people on that I've never spoken to, like in person or on the podcast before in my life, and I'll just hit record. We're going right into it. We're not messing around.
Yeah. No, we don't mess around here.
Candid off the bat.
Exactly. How you been?
Good. I got a confession. I think I've had more podcasts in the last 2 weeks than I have worked out. That's not good.
Okay. Well, you sent me, I tried to find a few other dates that would work, and it's like you're booked out till next July. So I don't really know. I'm really glad that we were able to connect.
Yeah, you didn't want to take July 18th? I don't know. What was that?
No, it's awesome though. I'm a big fan, and you cover a lot of great content that no one's talking about. So this is good.
Someone's got to do it, right? No, but this is awesome, dude. Like, regardless of what people think of Rogan, he's a great conversationalist, one of the best out there, I think. And recording conversations there's an element to it where, if you think about it, and you'll be on this, like, our phones are down. Everything's to the side. We're just chatting. It's recorded, and it's kind of like an element that doesn't really exist out there in the normal world, which has become unusual,
Yeah. See, what you got to do is you have to make a dental specific, or starting with dental and then branch out to other things, but a studio where it's you bring these people in. I want to be there with you in person. This is and hopefully my Wi-Fi holds up. Last time we had some of an issue, but I think I don't know. We'll see how it goes today. My housemates aren't playing Super Smash and using up all the Wi-Fi, all the bandwidth right now, at least. So I think we'll be okay.
Well, what do you mean about your Wi-Fi? I thought you're leeching off the neighbor's Wi-Fi right now.
I told you not to talk about that on the podcast. Thank you.
You got one bar over there. You got one Wi-Fi bar.
Exactly.
Yeah, man. Oh, dude. So I got off the Surgical Gourmet. He's one of the oral surgeons. He's in California. He's become a sommelier, and he had me we went over 4 different wines last week, and now I got 4 basically full bottles of wine that I'm trying to get rid of. So I'm just over here drinking on a Monday night, trying to get rid of.
This is all the more reason to have a studio, and then you have your people over, and there you go.
Oh, I'm gonna have multiple studios, Ax. I'm gonna have multiple studios.
Doesn't Rogan do like a whiskey thing with his participants, and that there's something like that, right? They try.
Oh yeah.
There's always a drink that they're having.
Oh yeah, there's a drink, there's a smoke. They're doing a whole
cigar,
bunch of things.
Yeah.
The cigar, Jesus, yeah.
We can't, with the oral health risks, we can't do that. But
yeah, not cigars. Definitely not cigars. I'm not really into Zins either. I've never had one. I don't know. Tobacco, I stay away. Tobacco and nicotine, I stay away from. I know what the risks are, and I'm like, there are better things out there,
my friends, I've had a few friends ask me about Zins, thinking that I know. To my understanding, it's just nicotine, and and there's no tobacco, and the carcinogens found in chewing tobacco are, I don't think there's any long-term studies on nicotine specific on pouches.
There's not. The one thing I've heard, this is Andrew Huberman. He's like neuroscience.
Mm-hmm. Yeah.
And I respect him. I respect his podcast. I really like his like demeanor and everything. He's saying that nicotine has shown, and I don't know of the studies. I haven't looked into it enough. I definitely need to. But he was mentioning how there is a decrease in the vascularity of certain areas. So I'm assuming if you put it in the vestibule, you put a pouch in the vestibule, you're going to have decreased vascularity in that area. But they're mentioning something how you get a buzz or something. I don't know, but anytime you have decreased vascularity to an area, yeah, that's going to make you more prone for infection, more prone to, decreased healing. You're not going to be able to, maybe not after extractions, but like, say you get an implant placed in the area and you've had, but then again, you're right. There's not enough research in it. Is it just when you use it? Or what about, say you use Zins for 20 years? What about the next 3 years? I don't know. I don't know.
There's not enough out there. Yeah. I mean, it's hard to make correlations, but people who are, that bragging about, oh, you do, they do 10 to 15 packs of Zin a day. I don't know the numbers. I'm not
Wow.
familiar really, but I mean, those people are probably not taking care of their oral health maybe to begin with, and it's
True.
not helping. It's not like you're sucking on a fluoride supplement. You're not. It's
Yeah.
not helping you. And I don't know, dry mouth, caries risk. All things you're very familiar with. Yeah, I'm not sure.
Yeah. All the periodontal stuff to talk about. Right? Just kidding. Just kidding. No, but
Yeah, no.
but yeah, the pack, the thing that I like about the Zins, again, never having tried one, I've never had dip or anything, but the thing about the Zins is the nicknames. We all have a buddy who's like, oh yeah, let me rip one of those Zimbabwe's, and I
Yeah,
don't know,
yeah.
I think it's hilarious.
Yeah, my friend's name is Allison, but she did one Zin, so now she goes by Allison. So it's pretty good, right?
That's pretty good. That's pretty good. I like that.
Yeah, it's good stuff.
All right,
But
so let's hop into it. So, what are we going over tonight? We're going over interview prep, interview ideas, interview expertise.
yeah, I mean, you're the expert here. I mean, you've gone through it. I'm currently about to embark on my journey here. And for people who have followed your podcast, I'm sure they know that you've been a great mentor for me, and I'm sure a lot of other people. But I think we've found a good balance where I'm able to ask you for advice, and we publicize that all, and I'm able to give back for the things that I've accomplished. And I think this is going to be a good thing for both, for everyone listening and myself included. So maybe you could just talk about your interview experience and like sort of what it was like, and then we can go dive into any details as they come up.
Absolutely, absolutely. And as you know, I did the Q&A session for September right here now. So I'll start with a little background, and then I'll hop into one of the recent questions on there as far as interviews go and like research first, other things. First, I would say I don't know about expert, right? They say dentistry is like it's a career, it's a profession where you're constantly learning. And I would, unfortunately. No, it's fun. It's fun. It's exciting and everything, but you always have to be on your toes. There's always new data. There's always new research being done. There's always new concepts coming out that you need to be aware of, right? Fluoride, for example, we were just talking about. The Zins. This is a new thing that people are doing nowadays. It's a good idea to get some familiarity with what it has to do with oral health, right? Whether you're an oral surgeon, whether you're a general dentist, whether you're a dental hygienist, you need to have some sort of basis to stand on when patients come into your office and you're treating them, you're cleaning their teeth, you're giving them recommendations and suggestions to benefit their oral health, right? They're coming to you for advice. Now, let's go into interviews and expertise. This is actually fun. And yes, and Ax, you've been on several now. This is fourth, between 3 and 5 podcasts you've been on now. And just for the record, the CBSE one on podcast is my number 2 podcast, right behind the Bloody Tooth Guy. Wait, no, number 1. I told you it was number 1, right?
Yeah, I
No,
think you mentioned number one. So
no, I'm
yeah,
sorry.
yeah.
It's number 1. 2 months ago, it passed the Bloody Tooth Guy episode, and now the CBSE dissection podcast is number 1. Bloody Tooth Guy is number 2. On YouTube, it gets convoluted because I got the shorts that I put out. I just put out one like 20 minutes ago, and then I have the long form videos. And recently, a TikTok Live actually got some views, but and we're talking very minor numbers. We're talking in the hundreds. Maybe one day, right? But anyway,
Yeah,
so
but the value you're providing is far beyond whatever the view count is. I think especially on the long form videos. I mean, people stay tuned to the end, and I'm sure you can even look at those analytics too. You can actually see when
yeah.
people click off, right, and that sort of thing. So I'm curious if we bored them to sleep about talking about Amboss in New World. I hope.
Believe it or not, no, there are people that have listened to that one multiple times. I mean, for the value that's in that, exactly what you're saying, the value that's in our CBIC dissection video, that the podcast, the YouTube video, a lot of people listen to, even though there's not a lot to look at because of the Wi-Fi issues. No, it was good stuff. Definitely good stuff. But okay, so that being said, interviews. As far as interview goes, and as you know, tomorrow's October 1st. So a month and a half ago, I finally signed to a practice. So I'll be working in Melville on Long Island with a multi-practice private practice. I did not want to go corporate. I couldn't go DSO. Going to be, they have like 6-7 offices, and I'll be working there as an associate for 2 years. And then hopefully, if I'm deemed worthy, to be brought on as a partner or given an offer to sign on as a partner. We'll see. But why do I bring that up? Because there are interviews involved, and I'm just going to like backtrack. So I'm starting with where I am now, and then I'm going to backtrack. You have dental school. Probably not going to go to applying to dental school. We're going to stop at residency interviews, applications, and such, and go in on that because that's where you are right now. And I know that's where a lot of listeners. I've been getting asked a lot about that for like the last 2 years. So we're going to go in deep there. But I just want to say my goal with applying to oral surgery practices, and it worked. It worked. My thing was. You'll go to, like, I was at Amos 2 weeks ago, right? And they all want your resume. They all want your CV. It's 2024. Who the hell is asking? So I get it, but it's 2024. Who the hell is asking for a resume anymore? You have LinkedIn. You have all the social media in the world. The resume is something static, right? It's a finite, it's one moment in time, and you're going to get that. And it's a piece of paper. And if it's too long, you're going to judge them. If it's too short, you're going to judge them. If you look at it, the scores, the grades, GPA, the school names, it's all a bunch of BS, okay? My point, it's 2024. We have LinkedIn. All the resumes on LinkedIn anyway, okay?
Yeah.
So if you're from 1960 and you're asking about resumes, there you go. It's on LinkedIn. Number 2, social media, LinkedIn, Instagram, Facebook, TikTok. If you're up to that date, which is now 4 years out, it's old in 2024's status, but it's very important in terms of if you're from 1960 and asking for someone's resume when they apply to your practice to work there, podcast, Snapchat. The big ones are obviously it's going to be Instagram. You get YouTube now too. Like, what are people do? This is what I'm getting to. It's dynamic. Everything on your resume is there. It's online. It's on social media. It's on LinkedIn specifically, and then a dynamic resume CV of who you are. It's all online. If you really care about meeting someone and learning about them, you're going to go to their social media accounts and figure out, oh, they drink beers with their boys every single weekend at the brewery playing darts, which is okay. By the way, I love darts and I love Spider Bite Brewery out on Long Island. But it's like, you're going to get an idea of what kind of person they are. Oh, they like to go to the F1 racing. They love to make balloon designs where they fold them up and twist them into special shapes and a dog and a tooth.
Yeah, can't even imagine. Don't even know what that would be like.
But
you're right. It's like video proof. It's in real time. It's video proof. You learn what someone sounds like. You learn what their interests are beyond listing them at the bottom of the resume in size 4 font, and you need your loops to see it. Like this is real stuff. And it's like, I mean, especially
let's grow up.
Especially for these, agreeing to work with someone on a contract or for a residency position where they're agreeing to work with me for 4 to 6 years. Like you might need more than one interview that could last 15 to 20 minutes and a piece of paper with arbitrary accomplishments where, they're just, you just do it for the resume. Well, what about all the other things I do? What about all the other things I do?
The biggest arbitrary accomplishment I've seen is research. Everyone asks me, oh, did you do research? And we'll get into that. But the reason, just to summarize this whole thing, the reason why I brought this up was when you asked, so for me personally, 2024, I make social media. We're connecting with audiences on large scale on different social media platforms. That means different attention spans. I caught a guy down in Amos. He came up to me and said, my mom loves your content. This is a University of Miami, literally Miami oral surgery resident. He's a chief. He's a 4-4 at Miami. He came up to me at Amos and he says, my mom loves your TikTok content. And look, so what I'm getting to is what I filtered out, job offers, applications. If you ask me for my resume, we're probably not getting very far. Okay. There's a lot out there. And if you don't know about it, and it's not a confidence, it's not an ego, it's not an entitlement thing. It's just the fact that we're in 2024. If you're not up to date with what 2024 involves, with everything that's going on, I'm probably going to move on from the practice. And that's exactly what happened. You know what I mean? Anyway, so interviews. Now, tracking from there to oral surgery residency applications and interviews. Let's get in. Now we're getting into the sweet spot, okay, to 15 minutes in. I'm sorry about that. I apologize. But to get into what we're really going into is you're going to have to submit your resume for oral surgery residency applications, right? It's going to go into the passport. Did you do that, Ax?
Pass is all done. So deadlines have passed, 95% of them, and just hearing back from programs about interview dates. That's sort of where we're at and nothing, I haven't gotten anything yet, but I have some invites, which I'm really excited about. And we hope that things continue in a good way. So,
You
my
told me
first one's
you got
going to,
interviews. You told me you got interviews. Let's
yeah, I did.
not
Yeah.
sugarcoat it. But what day did you submit? Let's start way back. What day did you submit your application?
Application. So there was a misconception. One of the things that we have to do from where we're coming from with the Stony Brook School is that we need a letter submitted on behalf of the dean. So
Oh
I
yeah,
didn't yeah, I didn't realize that the dean's letter, you can send your application in before the dean's letter is in. So the dean's office is writing, 45 letters. It takes them a little bit longer. I realized that I
yeah,
didn't have to hold back. I can just send my stuff and then programs can actually start contacting you, or just
yeah.
be aware of your application ahead of the dean's letter. So that's one thing that I noticed early on, but I'd say everything was in, maybe my first deadline was September 1st. And I had maybe, everything in at least 10 days before then. But I heard, and you correct me if I'm wrong, it's not really on a rolling basis. So it's all just a load of applications to get, sent to the program director. They look at them all
Yep,
at one time.
yep.
So I heard it didn't, I wanted to make sure everything was as complete and thorough as it could be. And then I sent it. And then, there's been a few programs I've added here and there, but for the most part, yeah, that's around when I did it.
Good. Add on more than less, right? You only want to go through this one time. Okay. No one's looking
Yeah.
at how many schools you applied to. That's for you. That's information that you can keep to yourself or let everyone know. I initially was going to apply to 40 schools, 40 residency programs. And then I found out when I did my VCU externship, what, end of July, that they had already tripled their record number of applications to the residency. So I was like, shoot, I didn't submit mine yet. I'm on my third externship, VCU. They've already tripled their record number. I think I'm going to apply to a little more. So I bumped it up to maybe, I don't know, maybe let's say 40. Okay, so it was initially almost 30. When I finally submitted, it was almost 40, somewhere around there, right? And I submitted on, it was like August 31st or September 1st, whatever. It was the last day that I wanted in my mind. So now we know you were roughly what, August 20th, give or
Yeah,
take,
let's say August 20th. Sure.
right?
That's
You
kind of
know,
where I was at.
this is very important information because people are wondering out there. They're like, when do I submit my application for? Now, dental school, it's different. Like we just said, it's not the rolling base submission, right?
Yeah.
Residency, it's
Also,
different, but yeah.
also another factor was the boards, the INBDE board exam. And for other residencies, I know ortho, they want to see your board score. They want to have it submitted. So those applicants should really think about scheduling their exam in a way that's strategic so that they can get their app in. With OS,
Absolutely.
and also it's based on your school. So, like, for example, Stony Brook just requires you take the INBDE before graduation. Some schools set a specific day or span of dates, but other schools, it's not a requirement to graduate. It's a requirement to practice. That's my understanding of it. So there was a thing in my past that allowed me to describe any aspect of my application that I felt like, it was an open forum in a sense where I could describe anything. I felt like my application was complete. I did what I need to do in my personal statement. And I think really that what I did there is I said Stony Brook doesn't require, their students to sit for the board exam. Like I said something along the lines of, it's not required now, it's required for graduation, but I will submit my score when I receive it. And that score should be coming back in the next few days, actually. But that's something too. You don't have to take the boards before you send out your app. Oral surgery programs seem to be aware of this specific issue.
Sometimes they are. Sometimes they are. I mean, I can't tell you exactly as far as the INBDE. We took the two-part exam. This is 4 to 5 years ago. And I took the two parts. So the first part I took after second year of dental school. And the last one I took, I was like, I don't need to take this before I apply to oral surgery residency. So I'm going to push it back after, since I have 6 months after match day before I graduate. It's plenty of time to do stuff. In fact, you'll see this, when you put in your rank list, you have a month or so. I think they shortened it a little bit. We had 4 full weeks before match day came out after we submitted the rank list. So I was like, I talked to Sean. We were like, let's take it during that time. Let's distract ourselves. Let's do that. So that's what we did. It worked out to our advantage. I know you can't do that now. but I just wanted to throw that out there, how it is a different aspect, and try to use things to your advantage. An example, like using that for an example. Okay, the next thing is, when do we interview? Is this it? Wait, do we skip something? When interviews is that? All right, so
So
get your
yeah.
application by September 1st, right? Next thing is the next thing when applications?
Yeah, so
Yeah.
basically, yeah. So I mean, like I said, September 1st is the earliest, but they go till like November 1st, November 15th. I've seen in some of the later ones. Then you get your interview. Yeah.
Yeah, just real quickly. Another thing is, when you submit and you're looking for what residency programs to apply to, 4 versus 6, all 4. Guys, a lot of dental students, they overestimate what residency programs are looking at. These people are busy. These program directors have a stack full of applications like this. They're not going through your individual pass applications saying, wow, this program only applied to 6-year programs. Oh, this person only applied to, oh, this person applied to 50-50. They don't really know what they're interested in. They're not doing that. Okay. You're way overthinking it. Apply to what you're interested in. And that might be different. North Carolina, only a 6-year program. Great program. Apply there. Kings County, only 6-year. Apply there. Certain programs, LIJ, they got both 6 and 4. Montefiore, only 4-year program. Apply there. Don't worry about what they're looking at, okay? Worry about applying to what you're most interested in and would be excited to wake up every single day and do it. Okay, let's move on.
Now, wait, Brendan, question about that actually. Would you say that your extern list of places you've been to actually tell a better story of the sort of applicant you are?
It can,
Or do you?
but the number one thing they look at as far as externships go is this applicant actually interested in coming out to the Midwest? I was very lucky and fortunate to get an interview with Oklahoma. I ranked it very highly. It was what a stud. Everyone that comes out of Oklahoma and some of those programs over there, studs. Oh my God, they're pretty awesome, But they were looking at, I didn't get many other interviews in that area because they're looking at my application. They're like, wow, all right, VCU, Montefiore, NYU. This guy's looking in the on the East Coast, probably Northeast. And they were right. My family's in the Northeast. My family's on Long Island and Florida. Would I have gone south? Absolutely. Had a girlfriend in New York. That's how it went. So I would probably put location-wise on the externship list. Number 2, externships. They're going to tell you, all right, what kind of cojones does this applicant have? Did they go to Cook County, LSU, Baylor, Montefiore, MedStar, VCU, Rutgers? They're going to look at the cojones size more or less, right? For lack of a better analogy here, but you get what I'm. No, how deep into oral surgery? How ballsy do they want to get? How willing are they go to kind of get themselves out there to show you, to see what's out there as an extern, as an applicant, and then understand where they're going to apply to and what program they're going to rank. Okay, programs are going to consider that extremely highly. That's what I'm getting to.
Makes sense. So let's talk about interviews. So you get your first interview.
Yeah.
What was the what do you do ahead of time? What do you learn that you don't need to do ahead of time? Like give me some of that.
My first interview offer was Houston. It was UT Houston, and great program, excellent. I really connected well with the person. But you'll see, like, you don't know what to expect on these interviews. You're going to be really nervous. You're going to have to go to the bathroom 3 times before you get in there, right? Make sure you pee before you go into that interview. No, that's actually really good advice. You
I
don't
was
have
going to wear a diaper, but okay.
You can wear the diaper. Just make sure it's under your slacks, under your skirt, your suit, whatever you
Got
wear.
it.
That would be my record. But like your first 2 to 3 interviews out of how many, right? 1 to 2, 2 to 3 interviews, they're going to be practice. And LIJ, Houston, and there was one other one. They ended up being like practice rounds for my later interviews, and you don't get to pick the order of which most of the time. There's like a couple interviews you get to pick the earlier versus later, and you could pick that based off of how interested you are in that program. How likely do you see yourself at that program for the limited knowledge that right? Pick the earlier one or the later one. I would pick the earlier ones as practice, and then you get to meet the attendings and stuff, and it's a conversational practice round for your later interviews. Okay.
Mm-hmm.
Did that answer the question?
Yeah, no, totally. I'm hearing that it's generally a conversation. I mean, I know you gave me some questions that I should think about preparing answers for. Some of them, if you want to maybe go through those so that others can go hear it.
Sure, let's hop in. Also, let's just really briefly timeline. September is when those interviews start. There are a few, very rare number, a couple outliers in August that come out, few in September. Most of them come out in October to November. Most of those interview offers come out. Okay, so right now it's September 30th. If anyone hasn't received an offer or an interview yet, look, most of them haven't come out yet. I wouldn't worry about it too much.
Well, yeah, for
And
one thing to add here is that the first interview came out this cycle there was a phone call in June for Indiana. I'm looking on the Student Doctor Network. People post when the interviews come out. And then, like, for example, there was an email on like early September was the first emails, but then it basically goes till November, right? Like that's kind of the span. So you can hear it anytime.
Indiana, wow, no, June.
June. Yeah, I don't if that's what someone claims here on Student Doctor Network. So
Yeah, that student doctor network can be very intimidating. And a lot of the information is correct, but everyone knows that everyone's got their eyes on student doctor network when those things go out. So there's a very high level of manipulation that can be utilized on that platform as well. I would just be careful, and that goes for dental school interviews as well as residency interviews. I've seen it all, and I wouldn't think anything less of the people on that platform because that's what goes on, unfortunately. And I know one of the attendings at Indiana, by the way. I forget it. He's actually the vice president of Aspen Dental. Great dude from Jamaica, stud. Guy's awesome. Got a nice family. He's got a couple daughters. I was talking with him at the Amos meeting 2 weeks ago, and yeah, really great conversation. But I
cool.
know a couple residents now, including him, the attending at Indiana, Cole University. That seems to just be a little early, like way too early. But anyway, all right, let's get into the next part. Questions. Number one, you need to be able to have your elevator pitch, your quick screening, rebuttal, whatever you want to call it. Your elevator pitch needs to be in under a minute and a half, preferably under a minute. And that's going to be, tell me a little something about yourself. Okay, that's the number one question. They're all going to ask you that. Every single interview is going to ask you that. If they don't, well, they're a little bit unorganized because I saw that too. And I know that now from being on the inside. It's actually more frequent than you'd expect. But that being said, don't underestimate how busy these people are. That's all I can say. The one thing I would say is when you're answering, tell me a little something about yourself. It's a conversation. Use a lot of buzzwords that are personal to you, okay? For me, it was like I did do research in dental school, but I also played the violin. These were my externship places, the programs. Went to church growing up, family person. Took my grandmother, who was very sick at the time, to church. I would play my violin for her on weekends after exams and stuff. And all of that was in like 45 seconds. Now you want
Yeah.
to keep it short because people's attention spans are very short, but you want to include enough buzzwords that have to do with you. They're unique to your personality. They're unique to your experience and your life. And I really found that musical instruments, for example, are a very big one because for whatever reason, a lot of people in healthcare, especially in dentistry and medicine, they played instruments in their past. MedStar and Christiana Care, they had attendings that one of them had like their own little, it was adorable. They had like a band, and one was like a bass guitarist, one was a guitarist, one played the drums, and they would go to bars every once in a while. And I was like, you guys are awesome. This is kind of funny, but it was adorable. It was great. It was cute.
Yeah.
All right, so tell me a little something about yourself. That's number one. Number two, tell me about your strengths. Number three, tell me about your weaknesses. Number four, why oral maxillofacial surgery over other specialties? And number five, why our program compared to other programs? How do you want to dive into these, Ax?
Perfect. That was great. Those are good questions to use. Let me think. I mean, I think one thing I'm wondering what your take on is a lot of things. A lot of the brainstorming I'm doing that went on during my personal statement and prepping for interviews. I mean, I think I have a good personal answer. But I think one struggle that I probably wasn't the only one to come across is I feel like a lot of the reasons I wanted to do dentistry do overlap with OS, like wanting to help people. There's the basic stuff, but it was sort of hard to narrow in on something that is uniquely oral and maxillofacial surgery because dentistry as a whole is a surgical specialty. So it's not like you're a med student applying for surgery and can make a case for wanting to work with your hands because all of dentistry is like that for the most part. So I don't know if you've ever thought about that specifically. I mean, of course, there's people have academic interest in the topic and they saw something that stood out to them. But maybe you have something that just I sparked in your mind that can really distinguish why this specialty over the other specialties. Maybe your own personal answer or something, just general advice for that.
Yeah, absolutely. And then I'll make it personalized to you. Really quickly, two other questions I just thought of that I remembered from my interview cycle. The first one was Dr. Bastidas from Montefiore said, "What's your biggest life regret?" So there you go. There's a little hint. That's a question right there.
Oh,
Another one, yeah. Another one was that was a big one because I told him that coming from Long Island, I should have just stuck with lacrosse. Damn it. Would have gone to
Yep.
Duke or North Carolina or
Yeah,
like.
but there's no professional. You can't be professional lacrosse is not the
I wasn't
same
gonna
as
go
being.
professional, but get a full ride to college at one of those Ivy League school. Anyway. What's another big question? Tell me about your externships. That's a big thing. Tell me about your experience up until now of oral surgery. They like to ask certain questions like that. What do you do with your spare time? Another one. Here's another question. It was, say dentistry didn't exist, or however they say that, set the scene, or like,
Yeah.
if this wasn't an option, what would you have done otherwise? My answer to that was, I don't know. I always loved producing. I really like to produce music. Anyway, okay. So to tailor it to what you asked, we had talked about this previously, and I had mentioned how you have your whole other side business where you're molding and folding and twisting balloons into
I
structures
love
and
hearing
shapes.
you describe this. It's so funny to me.
It's off the cuff, it's fun. But the biggest thing with that is, you're at kids' parties for the majority of the time. Those kids have parents, and those parents are there at that party, right? Most of them, for example. And I think oral surgery, now you could really get into pediatric dentistry for sure, of course, right? But oral surgery isn't that far different. You're managing some patients, you're managing kids, you're trying to get them under IV sedation, you're trying to put them to sleep, you're trying to take out their mesia dens stuck all the way up under their nose while the mom is out stressing out in the waiting room. Or you're just working with a very anxious patient who is still struggling to figure out how they're going to get this reimbursed, right? How they're going to get this treatment paid for, something that they really need. An infection in the mouth, an infected tooth, it's pussing out, whatever it may be. And they're very anxious and concerned, and they're all over every move that you make, every single thing that you do. And at the same time, you need to swiftly move your hands and to get that tooth out or stop that,
Yeah.
do the incision and drainage of that infection, whatever it may be, while managing the patient's personality, their aura, their anxiety. And this is a very common thing we see almost daily in the oral surgery office. And in residency, you meet a different demographic per institution. And from what I'm hearing now, being towards later in residency, you're meeting a different demographic and patient personality between the different institutions that's completely different in private practice, right? So there's a lot going on. And now I know this is a long-winded answer for what you were looking for, but the fact is that you have an experience doing 1, 2, 3 things, right? You're managing the kid. You're engaging with their attention span. You're doing your thing at the same time. You're folding up this balloon to make it look like
All right.
I don't know, a dog or a cat or a tooth, a
All right.
sword.
Whatever it is.
Yeah, the pig. Yeah, the pig, not the sword, not the.
Yeah. No.
But then you also have the parents in the background critiquing your
Yeah.
every move, like, "Oh my God, he's great," or like, "What is this guy doing?" Right? It could be
Yeah.
one, it could be the other, and so there's a certain amount of depth of engagement, of attention, of different people that we encounter in dentistry, in oral surgery. And, a lot of these patients in oral surgery are at their last wit, right? Like, they didn't trust the dentist. They didn't like the endodontist. They didn't trust the root canal. They didn't like the periodontist. Right? Here we are. This patient's got a very complex medical history and potentially not a easygoing personality. And we're the last layer, right? You got
Right.
to figure it out. And that's just how it goes. So,
Well, I think what you're saying too is that there's a
yeah.
lot of skeptics. There's people that sort of devalue all the years in school and everything you've done, or they're just genuinely nervous and they really just ask a lot of questions, not because they're worried about your own skill set or whatnot, but they're worried about things happening to them. And I've kind of, after thinking about it pretty deeply, like I see connections with my business and owning and twisting balloons in a way where, everyone's perception of balloon twisting is dogs, swords, and like worms, right? It's like the most boring stuff. And for
Worms?
me, I mean, that's an easy way out, right? You give a kid a worm, it's a win-win because it doesn't take very long. But what's it called? Like part of my job is like is changing people's perspective and perception of what it means to make balloon animals. And it sounds silly, but in reality, there's similarities to OS. Like for example, if someone jokes with me, can you make a squirrel in a UFO? No, this is not. I'm not just coming up with this now. This has happened. I get these crazy requests and I make them happen. And then watching me do it inspires the next kid on the line to take it a step further and a step further. And then the parents are, each opportunity is not only a chance to connect with an individual kid, but it's also a chance to advertise myself and my skills. And over time, I get better and better. At first, I used to say, no, I can't. Well, I only make SpongeBob. I can't do Patrick. But like, no, over time, like the first Patrick, trust me, I remember what it looks like. It was terrible. Like, I feel bad giving it to the kid, but the Patrick's, the whatever, the Squidward that I make now, that has now gone through all these revisions, and I've gotten feedback. And I think a lot of that's similar to being a good surgeon, is kind of assessing where you're at and working under pressure. I have a line of 200 kids online. I'm working in a school district. I'm working in a block party or a corporate event. I have to be able to not only introduce myself, be all friendly and cool and calm and collected the whole time, but also be on my toes, thinking, molding, doing all the things like you were saying. So, I've thought about it a good amount, but yeah, that's kind of the approach that's the overlap that I see.
That's exactly it. And now back to where we are. Let's get back to the spine here. Recognize what you're doing differently, what you did in undergrad, what you did in dental school that's different from other applicants, right? That's unique to you. And maybe it's not so different. It doesn't necessarily have to be. What needs to be unique is your perception of it. And that perception is ultimately how you're going to connect or not connect, but mostly connect with that interviewer, right? If you can be creative and descriptively explain yourself and communicate to the person in the interview who you are, what your goal is here. Are you just doing it for money? No, I'd hope not. On an interview, I'd hope not. What are you doing it for, and where does that relate to your whole life from where you came from? Because that's how they can predict what kind of person you are and where you're going. And that's what the interview is at scale. Okay, so and you completely get it. I know you get it. I'm just trying to break it down for listeners. That's how it goes. That's how it goes. You need to think outside the box. You need to be creative, and you need to think how you can elaborate and explain and communicate that across to the person on the other side of the. Now they're mostly in person, sure, but virtually as well. I had to do all my interviews virtually, so that was interesting. But yeah, so that's that. Most interviews have to be done roughly by December 21st, if I remember correctly. I think my last one was on December 18th, 2020, actually. Yeah. So to give people a timeline of like when to expect interviews to come in and then when their last ones will be to finalize.
What about some of these interviews have like a social aspect? Did any of you were Zoom, so I don't know if there was much of that, but
there were. Yeah, they'd have a social online. They'd have a Zoom call where they'd have a big open room, and then they try and separate into groups at the time. Look, you got to go to the social. I mean, my voice may or may not matter at my residency, as far as applicants and such, but if it was to matter to me, I would really consider the socials very highly, because that's how you get to actually learn what someone's like. Some people freeze up on interviews. And guess what? I understand that that's normal. We all freeze up here and there, right? I don't know if some of these interviewers understand and really understand that, But a social is going to be able to get someone in an environment, maybe they're a little more relaxed, and maybe they're not more relaxed. If you can't relax on an interview and get your point across, and you can't at the social, we got a problem, right? This is two atmospheres. One's more professional and strict. One is like, have a beer. Let's talk. Let's chat. One or the other, hopefully both. You need to be able to excel, and you need to be able to get your point across. You need to be able to open up and connect with another person there, right? It's a conversation. Yeah. Both of them are conversations. The socials are great. You got to go to those, right? It's not a home run. You don't need to hit it out of the park at the social. Hopefully you can at the interview. But the fact is the socials weigh very highly on residents. Residents are going to be talking with you there. They're going to try and get to know you, get to know who the applicants are, get to see who's interested in their program. Who are they going to have as their first year resident, right? The rising 3s and 5s, 5 out of 6, 3 out of 4. Those residents are going to be chiefs next year. And they're going to be very influential on those interns, quote unquote. I try not to use the word intern. I try to use first year, because intern does come with a bad connotation just from my experience in a residency program. And now that I'm chief, I want to actually try and make a difference. And one of those little minutia is I'd rather call someone's first year, right? Because I'm no better than you. I just have been here for 3 more years. I'm not necessarily smarter or dumber than you. Although some people, it actually gets that way in residency. And we'll see how it pans out. But that being said, I really think that we're all on the same playing field. It's just a matter of years. And I try to break that down to the first years and say, like, look, you did really good this weekend. Hey, I know you had a lot of calls. You didn't sleep a minute last night, but you did really well. You managed that very, very well. If you want me to go over notes, we can. Otherwise, we don't have to. But you'll do better, even better the next weekend. Just stick to your guns, stuff like that. And
I like that.
I did that last weekend. with residents. And you need In residency, this is what I recognize. You need to know that someone has your back. And unfortunately, a lot of people don't. They're in it for themselves. And you need to be able to recognize that. You need to be able to find those that are there to work with you, not make you work for them as your
I love
servant.
that. Yeah.
So anyway, getting back to the interview process, what else can we dive into before we got to get going? I know it's getting late.
Yeah, let me so as we I mean I think we hit the majority of the interview process. Let me think. Would you recommend I mean I know the answer is yes, but let's say there's a program that you really really like and you really think it's the right match. What would you do in those scenarios?
Number one thing is definitely extern there. And now when to extern. This is something that dental students need to understand a little bit more. I don't get enough questions on externing timing, right? They ask about when should I extern, but your externship trail should lead in the course of your interest, right? If you're a second year going to third year of residency and you're going to go on an externship, that's great. I'm not going to say don't do it. But don't go to it's too early on, right? Don't try to go to that number one program so early on. If you do, you're going to have to go there again later on. My recommendation is if you think you're most interested in a program, try and schedule it early, October, November, literally like right now. You should be calling those programs for externing there next year. And where am I getting to is because when you extern in the summer after your D3 year going into your D4 year, that's when you're submitting your application. If you extern there and you do a really good job, hopefully it's like a reach school, so to say, and you do a really good job, you're going to be fresh in their memory. When they see your application on that pile of papers, they're going to recognize your name, they're going to recognize your face, whatever it may be, and you're going to get that interview. If you do it a year and a half early, in between the winter break of D2 year or in between D2 year and D3, that's very early. That's not, they're not going to, they might not remember, hopefully they do, but they might not. There's just so much that goes on in a year's time. So I would recommend your primary focus, those programs that you're most interested in getting into, extern them in the summer between D3 and D4 year, maybe later in the summer, July, August, right? Because your application is going to come across their desk and you're going to get that interview. That's what I would say.
What about though after interviews? There's like
Oh,
a
after
place that you
interviews,
really want. Would you I've heard you can visit. You can I don't know.
I
I
would
mean,
ask.
there's not much more you can really do.
Yeah, there's really not. There's really not. Definitely send within 24 hours. Definitely send that follow up email. Definitely say, hey, thank you so much for giving me an opportunity to interview at your program. I really appreciated this and this, and I would be excited. I would be humbled to be a resident at your program. Something simple, short and sweet.
Yeah,
Don't make it more than a paragraph long. Try 2-3 sentences tops. Okay.
100%. Yep.
Don't put more work on there. Don't make it tedious to read your stupid email. Just say thank you. One or two things. Maybe say like, I was super impressed to hear that you also still play your instrument, even in such a stressful job as oral surgery. Something where it's like it's heartfelt, right? And mean it. Don't try to BS someone. They sniff that from a mile away. I knew a guy who he's at Cincinnati now. He's a chief there. He was externing at the same time as I did at VCU. He would send a follow-up letter. And now here's the thing. Really sweet, very thoughtful, putting in your handwriting, a little signature at the bottom. You recognize that the program director didn't receive that until a week later, maybe never, because it went to the program coordinator. And by the time the coordinator got it, they're like, I don't even remember who this guy is or girl.
Yeah. No. I think we got to stick to email. I mean, it's nice, but yeah. No, that's funny. I mean, it worked out, but maybe some program
Letter.
worked out. Yeah, that's funny.
Letters. I just saw him 2 weeks ago at Amos. He's
Yeah,
a stud. He's killing it and everything in Cincinnati. But
amazing. Yeah,
yeah, that's something to consider. Yeah, definitely.
but yeah,
Just
I think when you were talking before, I think another the next time we talk, let's do an externship. Break it down. What it's like to book an externship when you do it. You don't learn a lot about like etiquette, like what to say, what to
mm,
do. So I think that could be a value. I do a lot of mentoring for people in my school, and those questions come up all the time. And I think I think the two of us combined can give some good information on that. Yeah, let's maybe we could book that in July of 2028 or something.
that's a
The,
great
the,
idea.
yeah,
Actually,
your next
or a
opening.
few months. March, April, right before like the year of externship
Yeah.
season really begins. Look, that would be a really good idea. In fact, Ax, honestly, we should definitely do that. We should probably also consider maybe we bring on someone who's about to begin externships just so they can ask real-time questions. Someone who's
Yeah.
articulate in their thoughts like that. Just something to think about. But yeah, dude, this went a lot longer than I expected. I know. Sorry about that. Hope you
No,
had time
do
tonight.
not apologize. I got a lot out of it. I think, I know I love talking, so this was great. Appreciate
This
it.
was a good one. No, this
Yeah.
is going to help a lot of people out there. I'm thinking of like interview and application for a title. I'm also trying different thumbnails where it's just like name and Instagram handle. For this one, I'll put like interview and application. That might not fit though.
We'll brainstorm. We'll brainstorm.
Yeah, yeah. I was going to try and get up tonight, but
Just
I
call it
got
OMFS interviews. I think that's probably the way to go. I don't know.
yeah. We could do that because we also put in applications. All right. Oh yeah. Residency or OMFS interviews, that's fine. Also, just to give a little shout out, tomorrow night I'm on the pod with Bloody Tooth Guy. Wednesday is Jawman, that's Dr. Ross Chafkin. He's the private practice owner of all 6 practices that I signed with. And then Thursday is Dr. Brady Smith. He's a general dentist, but he's got 113. I don't know. He's got a ton of followers. He's got very interesting and different content. But that being said, I wanted to ask you, do you have any personal questions you want me to ask these guys on the interview? I think that would be. You want me to ask them anything for you?
It's a good question that I don't know if I can have anything right now. I mean, the Bloody Tooth Guy is a legend in the OS community. I mean, I mean, if I think of anything, I'm going to let you know. And then if
Let me know.
you know,
Let me know.
because you're doing it tomorrow.
Yeah, tomorrow night,
All right.
6 p.m. is Bloody Tooth Guy. Dr. Chavkin is Wednesday at 8 p.m. And then I think Smith, I forget the time, but
Cool.
yeah.
Cool.
How much
I'll just
money do you make a year?
That would be a crazy first question. That
How
would be
big is your
yeah,
house?
right. How big is your house? First question.
Just joking around. Just joking around. All right. Hope
That's
you
good.
got that joke. Anyway, all right, dude.
Good
Axe, thanks
stuff.
for coming
All
on.
right,
Good
thanks,
stuff.
Brandon. I appreciate it, man. I
We'll
will.
talk soon. Just give
Yeah,
it a second if you can just close it out a minute so that it saves. All right, dude.
yeah.
Just on the podcast. All right. Just give it
Okay.
like 45 seconds if you can.
So leave and then just let it sit for a sec.
Let it sit for like 45. Give it like, if you can, give it 2 minutes because then I won't have to like email you later for it to upload later on.
That's
That'll be
fine.
annoying
That's
for you.
no
Just let it.
problem. No problem. All right.
All
Sounds
right,
good.
dude. Good stuff. We'll
Okay.
talk
Bye.
soon.